Welcome to Talks with Teads. I'm Eric Amato, VP of Sales here at Teads. With me today is Jan Weinstein. She's the EVP at Publicis Health Media. Jan, thanks for joining us today.
Thank you for having me.
Great to have you. Talk to me a little bit about your career.
So I'm currently EVP at Publicis Health Media. I've been there about just over 6 years. I've been focusing in the healthcare space in media over basically past 20 or so. It's become a real passion point of mine. And while I haven't exclusively worked in healthcare, I really find it to be very gratifying. I've worked at most of the major holding companies on clients large and small, lots of verticals, including CPG, travel, but, again, focused on healthcare now.
So you've worked in healthcare and consumer brands.
Yes.
What's one shift in behavior that has influenced your approach to media strategy?
I think the biggest shift that I would say is the more input and control a consumer or patient has over their experience with marketing. So when I started working in the business, it was very much of we're going to show you an ad with an expected outcome. Now there's so many other ways that people get information, so many paths that they can follow around doing their own education, posting their own content, working with influencers. So we really have to think about like a multifaceted way of breaking through and being resonant.
How are you helping brands connect more meaningfully with women, particularly in the health and wellness space?
Yeah. I mean, it's a really important topic. And again, a passion point of mine. Women are very hungry to talk about their concerns and issues. There has been a lot of stigma, but what there needs to be and what we're working on is just more content, more opportunities for women to have the conversations. Marketers can play a really important role in facilitating those important conversations via creating communities, supporting communities, bringing in digital opinion leaders, and making sure that we're supporting women in all their health concerns.
What's one challenge healthcare marketers still tend to underestimate?
Ooh, I have to say, I think we feel that we have a lot of input when it comes to the messaging and the media, but there's other factors like government and access that don't always come into play and not always things that we can control. So we have to be, very much on the pulse of what's happening outside of things that we can impact.
Looking back, what campaign most shaped how you lead today?
So I worked on a campaign early in my healthcare, career for mental health, and realizing how this impacted people's lives. There was a woman who came to the client and our company and said that her husband was planning on committing suicide, and seeing the messaging changed his mind and made him realize that he could and should get help. So how that helps me lead is by making sure that my teams know that what we're doing is a very high order. We have the opportunity to impact lives, potentially save lives, or at the very least, make people's lives better. And this should power what we do. So, thinking about that and realizing that we are part of a way of having a healthier, more, just happier population is an important leadership goal of mine.
Jan, thank you so much for joining me today.
Thank you so much.